How do you differentiate yourself from these other guys that are doing AI in DME?
The really awesome thing is that I think there's plenty of room for everybody in this space because there's a different niche that people provide. One of the things that sets us apart is the fact that we were born out of the DME space.
How do you balance all this exciting stuff going on in your life?
Having really good people around me. Our team that we have in each division and recruiting really good talent recently, which has been very exciting. That's really, I think, the secret. That's the biggest part of what people are trying to figure out is where is the best way to utilize this? Because there's so many ways that people are talking about implementing AI, but where do we start?
Adam Nagler, we got you on the Claim to Fame podcast. Welcome, man. How's it going?
It's going really well. I appreciate you guys having me on. Excited.
Yeah, welcome, Adam. Thanks for the time, my man.
My pleasure.
Happy to have you.
Yeah, are you nervous today? Are you feeling good?
A little nervous. You know, we're actually first podcast, so I could say it's a little bit nerve wracking, but I know you guys, so it should be good.
Yeah, you'll be all right. You'll be all right. I mean, you're in front of Epcot today, so it probably feels pretty good for the soul.
Yeah, I'm standing right outside. It's perfect.
Yeah, well, you are in South Florida, so
Yeah.
Yeah,
well, awesome, Adam.
Where's Handfinger at?
Dude, he's right here.
No way. Get this guy in here.
Yeah, pull him in.
We gotta say hi to. We gotta say hi to him.
Oh, you're right. You gotta say hello to Alex.
Are you kidding me? Get that guy. He's a legend.
It's a special appearance.
It's Alex and Wayne from Nico, man. We got a podcast.
Yeah, welcome.
No.
Hey, we're live right now.
We're live. We're on the podcast.
Welcome.
Let's go.
It's amazing. Should have worn a
Yeah,
nice shirt. That's what I said. I didn't know this was gonna be video.
I didn't know. Good seeing you.
Yeah, it's video, it's audio. We'll get a lot of awesome clips. But yeah, we're live right now. Welcome to the podcast.
That's awesome. You know, I was hoping that we'd actually just get the cardboard cutout of Adam instead of the real one today, to be honest.
I don't even know where that thing lives. Who has it?
Oh, it's in the office in Atlanta.
Anyways,
well, Adam, the man,
the
the man, the myth, the legend, Adam. Thanks for joining us. So, for those of you that don't know you, you're the man behind not just one, but several fast-growing companies in the DME space. So, let's just start at the beginning. What was your kind of first real exposure to the healthcare world, and what got you into the business?
Okay, so that's an easy one, right?
It's super easy. It's your life.
Yeah, right. So 17 years, I was a equity trader for a hedge fund based out of New York, but we had a Florida office. I had a good friend, Phil, that you guys, I think Alex hasn't met Phil, but Phil Vasta was my first partner in our first healthcare venture. It was called My Pharmacy Assistant. We had a close friend who was a personal trainer, a very close friend of ours, who got diagnosed with multiple sclerosis. And she couldn't get her medication. She was on Blue Cross Blue Shield of Florida. She had this medication called Copaxone that was about $8,000 a month. This is around 2014, 2015. Wow. So we put on a fundraiser for her. I actually looked for ways that we could get her meds, and I came across these programs called these prescription assistance programs. They're programs that are offered by the pharmaceutical manufacturers. So if you ever see like, ask how AbbVie can help you get your medication for free, all these commercials, right? They advertise free meds, but they make it really, really difficult for these people to get the medication. So if you don't, cross a T or dot an I, they'll deny you. I actually filled out an application for Copaxone for our friend, and she got denied several times doing it on her own. I did it. I got her accepted into their program. And when you get accepted, they're called prescription assistance programs. When you do that once, you're in the program for an entire year. So for 1 year, she was able to get her MS medication for free, and I did that for several years. I had another friend, unfortunately, whose mom had stage 4 cancer, and they basically were giving her the runaround with another manufacturer. They were saying that she couldn't get her faxes, and I did this for our other friend. And I turned to Phil, who I've worked with for a long time at my trading firm, and I was kind of getting at the tail end of, wanting to be a trader. I wanted to, get into another business. And I said, Phil, I think there's an idea here for a company. You want to be partners? So he said, yes. We didn't know anything what we were doing, got into this company called My Pharmacy Assistant, built out a call center, built out some technology that kind of combined the applications. We had to go to the doctor's office, so very similar to DME, go to the doctor's office, but it had to be on the paperwork of like Eli Lilly or Pfizer or Merck. The doctor had to sign the paperwork. We had to submit their tax information to the manufacturer, and then they would get approved for the drugs. So we built that business. And in the meantime, Adam Handfinger was a member of my CrossFit gym, and we became close.
Gym bros.
Yeah, we became close that way. And he's like, listen, I'm a lawyer full time. My college roommate has a DME company that I'm kind of help managing it. They do diabetic shoes. I just made partner at my law firm. I know that you guys are doing stuff with prescription assistance, and it turns out a lot of our patients were patients on insulin. He's like, that were on Medicare. So you could take your flyers and we could take our shoe fitters and you could put your flyers into the boxes and we could kind of see what could happen from here. That kind of evolved. We grew this business. Handfinger decided he got too busy for the shoe business anymore. He's like, you guys want to take over our DME company? We have a bunch of shoe fitters that are out there in the field. And I'm like, I'll figure it out and we'll learn it. So that was in early or mid 2016. So we pivoted to a DME provider. We started giving out the prescription assistance information for free to people that were calling us because we knew that if they were on insulin, they would be qualified for shoes or they had diabetes. So it became like our lead funnel. So we had this call center engine that kind of fed this model of diabetic shoes. And then we kind of figured out what other products can we offer. And the timing just happened to be right for us to get into the CGM space. We had people on the phones, people that were on insulin. This was, back in 2016, 2017. So CGM started coming around the end of 2018, early 2019. And that's when I reached out to Abbott and to Gemco, which they kind of pointed me to Gemco to say, oh, okay, if you want to buy CGMs from us, here's a supplier. Go figure it out on your own.
Yep. Shout out Gemco.
Yeah. And which ended up being a great relationship. Those guys are awesome. But that's how we started. So we really pivoted from prescription assistants into DMEs, tried some other different product categories, but I really saw a huge opportunity because it gave us a level playing field against other suppliers. So like people that existed in the marketplace that was doing sleep, which I didn't know anything about, or catheters, anything that we could direct to consumer. It gave us that competitive advantage and also gave us a way to acquire patients that was a lot different at the time compared to these larger nationals or regional players that had a sales force that would go into doctors' offices and build out their team by asking for prescriptions and earning business. We had no idea even how to structure that. We just knew that we had people on the phones and we could sell something on the phones to them. Understanding like regulations and the regulatory space was obviously important to us as well. So that's when we really made a hard move into the CGM space.
Yeah, it seems like Adam I haven't heard that story before. That's, you answered a lot of questions that I had. It seems like you saw an opportunity in the market that, at least a way to penetrate that other people didn't see, as opposed to some of these other ways of getting business through the prescription service, which I guess kind of leads me to the other venture that you have going on, which is Compliant RX. I know you were early on in implementing AI in your own business, and it sounds like you probably saw something there early on that people didn't see as well. Can you tell us a little bit about kind of how Compliant RX was born and, what specific problems that solved and kind of how that came to fruition to where you are today with that product line?
I'll blame Handfinger for that one again for these ideas that he's constantly coming up with.
Yeah, well, there's the idea man, then there's like the guy that executes it. So you need both.
So the funny part about that business is, as we were building out our DME, that wasn't difficult enough. Yeah. Adam was working at his law firm and he saw an opportunity for artificial intelligence to read contracts, and he came to me and he's like, I have another idea for you. And I said, what is it? He's like, I read contracts all day long. This is back in 2018 where AI, no one even spoke about. I really believe that artificial intelligence is going to be the future in construction and legal space. Do you want to be a co-founder and invest in this other company with me? And the company's called Document Crunch. Knew nothing of it, but we leveraged a lot of our resources from a tech perspective that we had built out, just understanding developers and what it takes to build out technology. We used some of our team to kind of say, hey, we're starting a new venture. We kind of learned how to build things a little bit on our own. Here's what we want to do. And we leveraged an AI platform at first. And we built out Document Crunch. Really was Adam's idea. I kind of put things in motion for the tech and the team, but he was the brains as far as like the subject matter expertise. That was, like I said, in 18. Since then, that company, there were three of us that co-founded the company. It's gone on to do really, really well. It's based in Atlanta. There's 100 people that work for the company, give or take now. Wow. We raised a Series B last year. I'm just an an investor and a co-founder. Really, Adam and Josh Levy, who is the current CEO, who's our third co-founder, has really built that business. But while we were doing that, at the same time, when Quest Health Solutions was scaling for CGM, like there has to be a use case here somewhere in this industry to do the same thing with what we're doing. And since we had that AI engine that we were licensing, I started training and tagging diabetes medical records from our database and training our model and seeing if this could actually be something that we could utilize inside of our business. So we kind of leveraged our tech that we had from Document Crunch and built out a beta for taking all of this data, de-identifying this information, tagging insulin, all these keywords, which is very different than generative AI that we see now, or it kind of knows. So we had to take instances of just like different types of insulin, patient diabetes, encounter visit, and we built that, and we used our business to be the beta, the pilot for it, and that's how CompliantRx was born.
Wow. I love that. Battle born.
Yeah.
Question
awesome.
for you, Adam. So I asked this before. We've had Trey from Tenor on. We're looking to have a Notable Systems on. There's obviously other players in the space. How do you differentiate yourself from these other guys that are doing, AI in DME?
So great question. The really awesome thing is that I think there's plenty of room for everybody in this space, because there's a different niche that people provide. One of the things that sets us apart is the fact that we were born out of the DME space, right? So I've scaled a DME business from zero to where we are now, and understand the pain points of a company that might be doing a couple $100,000 a year in revenue to tens of millions of dollars a year in revenue. Looking at the audit space and compliance, being in the DME space, what scared us the most is audits, and having a UPIC, or we just had another TPE which we passed 10 out of 10 on our first pass, which is awesome, and is a testament to how good our software is. So the name CompliantRx really says it all, right? We have workflow automation. Over the years, AI has changed, so we do have some ability to automate a lot of the intake, which has kind of now become the standard of the business, where you can scrape the data from an OCR off the patient's information, off the medical record, maybe get rid of the intake process or the burden of having to rekey stuff. But our main focus when it comes to this outside of workflow is, are you submitting proper claims to Medicare? Because there is so much fraud, waste, and abuse in our space that it gives good players like us a bad reputation, And so when you're scaling and you're servicing hundreds of new patients, in a week, in a month, and thousands of reorders and resupplies that we have to put through, the technology and the AI became very key into how we can grow our business and grow it the right way. We didn't want to get sloppy. So being able to kind of relate to someone in the space and say, this is what we've done. We understand what your pain points are. We know what a hassle it is when you get a RAC audit or a TPE audit or a UPIC audit. We're here to make you feel a little bit better, even though you have that knot in your stomach saying, oh geez, I just got picked for a post-payment audit. Are all my documents good? And what we focus on is, over the years, as you grow, you hire progress note reviewers or medical record review specialists that need this subject matter expertise, and you train them and you invest a lot of time in that person. We kind of make it a little bit easier to take maybe a person that doesn't have that clinical expertise, maybe have a team lead that sits above them to train them on medical record documentation, because we built out a UI that is for compliance purposes and goes through these payer guidelines. So you can scale a little bit better. And also you have an audit trail. So we all know KPIs and metrics are important when it comes to business. As you grow and as you have to report to a board and you want to continue to excel, people have to hit their numbers. Sometimes people shortcut what they do, and there's not a lot of checks and balances when it comes to how many medical records were reviewed. How do I know that each person that's passing through and getting billed to Medicare or United Healthcare really meets the coverage criteria of each product category that you're billing for? And now we have those checks and balances in place that I can say, okay, Alex, you're supposed to review 30 orders a day. Did you review 30 orders? were those reviews completed by you? And once they're submitted through our system, we could be confident in the fact that we're going to get paid on them. And when we do get an audit, I could go back and look at who reviewed it. Was it compliant? Can we pull that audit record and, provide that to the auditor a lot quicker than if we had to mobilize an entire team almost like in a panic to say, everybody stop what they're doing from a regular business perspective. And now we have to take specialized people and say, okay, work on these audits. And I think that's where we really are looking to differentiate ourselves in the industry.
Yeah, a lot to unpack there, Adam. One thing that jumped out at me was I really like the fact that somebody does not have to be, an extremely seasoned SME to be very effective with tools like this. It seems like it just really lowers the learning curve. And I think I just saw you post on LinkedIn or some of the marketing with CompliantRx, but it's not so much about replacing people. It's keeping the same people, allowing them to do more essentially, because at some point, a human needs to be involved to some extent, but if they can do 3 times the amount of work, hypothetically, 3 times as accurate, there's massive value in that. And I also think it's incredible that, it was born in your own business, and there's, a lot of evidence there because of the scale you're at. So really cool stuff, man.
Thanks. And I think that's an important point. In the last year or so, pitching AI to a lot of people in our industry, or just in any industry, the first thing that they think about is, I'm going to lose my job. And now, in certain industries, there could be truth to that. Like, you look at our call center, we might have AI agents that are in the future calling out and qualifying patients, and there might not be a need for quality assurance people because you could do so much better with automation and AI. Within the DME space, we collectively as an organization have such a large amount of respect for the people that have been in this industry. Every show that I see you at, Wayne, you've been on the circuit for years, just going to MAMES recently, right?
Yeah.
Or going to, VGM, or seeing these regional events. You talk to people, they've been in the industry for 20 or 30 years. They have such deep amount of knowledge in the space that you do not want to lose that. And I think when you have this shift to technology, some of those people are kind of worried about, what I know is going to disappear. I don't think that's the case. You've heard the term like human in the loop technology, because you still need that person, right? So we want to kind of give you that co-pilot, which is another differentiating factor in our system. I know that you guys know Noel Neal from AccuServe. So we have a product feature, and Noel's an advisor in our business. Ask Noel. It's a little pop out that comes out to the side. You can kind of query the medical record as if you were kind of speaking to an expert. So having that at your fingertips there, I think, is really important. But then having those patients just kind of understand it, maybe get more knowledge, and then reach out for some additional patient care rather than just doing a task all day is where I think this business is going. And we've seen more acceptance, I think, from last year to this year, and more education in the space about it, and more understanding, and just saying, okay, I think we're good. This can make my job better. So it's exciting for the changes that we've seen.
I think AI, obviously with you're in the business, but I think AI has come up on every single podcast episode so far.
It's definitely been the theme.
Even 18 months ago, wasn't really much of a conversation, let alone 2 years. But I think you guys were super early, started looking at it back in 2018. So is there, anything else that, you covered so many amazing topics. Is there anything that excites you about AI that you think some people are sleeping on, or anything, just doesn't have to be about DME, but anything that excites you about kind of AI, or any cool use cases that you see out there?
I mean, for us in our core business for our DME space, we have a large call center. So we have a lot of patients that call our ads, react to our traffic, have questions about customer service, helping them get set up on the devices. With conversational AI, we could use a lot of our outbound agent AI dialing to handle some intake at first, to kind of do the fronting or the discovery for people, to then get transferred to more of an expert about the product. Same with our remote patient monitoring division, because we have started that last year, which has been very successful as far as outcomes, which we're really excited about. Not doing the care, but for example, integrations with an EMR, scheduling an appointment with a physician, or scheduling a 6-month follow-up with a doctor, utilizing that because the conversational AI sounds so good and so real. And the experience ends up being consistent across the board, right? Where you're asking the same questions, that person is responding a certain way, the AI can understand them, and if they need to escalate it to someone else, they can. But I think from a perspective of leveraging that across your organization, there's a lot of use cases, but at the same time, you can get paralysis of analysis. So
Yep.
we tell people start somewhere. If someone comes to us for Compliant RX and they have 6 product categories and CGM is one of them or sleep is one of them, we say, we're not going to sit here and say we're implementing it across your entire organization. Let's start with one product category. Let's show you that we can reduce your medical record review and your intake process from 20 minutes to 5 minutes. Get your team to understand what this looks like for one use case. Let us earn your trust, and then over time, let us roll this out into other product categories that you have. And I think that's the biggest part of what people are trying to figure out is where is the best way to utilize this, because there's so many ways that people are talking about implementing AI, but where do we start?
Right. It's probably a little less intimidating when you start at one part of the business and then slowly see how you can implement it across different, areas, right?
And from a perspective of like us owning this product and going out to a customer, it's too much pressure to put. Do I want all your business? 100%, right? But what we have in this, the DME space is small. All we have is really our reputation and our word, right? And seeing, you guys know, Wayne's grown this. I've watched Wayne over 6 years grinding at every show. I have a tremendous amount of respect for him, but Wayne's a prime example of like building relationships over time and getting accounts. And we could start with one part of your business and show you that this really is going to be an effective tool for you. And we don't need everything, but we're going to prove to you that we're going to be a good partner. We're going to help you, and we're going to be there along the way to teach you what needs to be done. And over time, we're going to have a customer for life. And I think that's the important part of it.
Yeah, it's just, I always say, there's 2 things I always say. We don't need to boil the ocean today, and time in is greater than timing sometimes. I know you were a trader, which might feel a little bit different, but for Nico Health, like it'll end up being the same story. It's about building the relationships, doing what you say you're going to do, and the staying power is definitely something as well, because definitely things come and go. With that being said, you have a lot of irons in the fire with stuff you're working on, Adam. Just like from a business perspective, to our listeners, how do you balance all of this and still be a gym bro on top of all of that? How do you balance all this exciting stuff going on in your life?
Having really good people around me. Our team that we have in each division and recruiting really good talent recently, which has been very exciting. That's really, I think, the secret. Being able, when we started the business, it was me entering orders in the system, learning medical record review, doing a lot, and giving up the control and kind of decentralizing everything to say, I have a team, we have a good organization, that organization has structure, I trust the people that are working for me. That has been very difficult to get used to, but as we grow, not being able to be so into it. Not that I'm a micromanager. Now it's like I want people to go out and do their own thing, but finding the right people that I could trust to say, okay, this is your box. I know that we picked the right person. You're gonna do really well for me, and let's figure out how we can always continue to make things better. Let's have these meetings. Let's do the things we need to do, and problem solve together. I think I really like to solve different problems. So also separating my time and blocking my time for different parts of our business is important, right? Not channel switching your brain. So blocking up time in the morning for Compliant RX, midday for Quest, afternoon for RPM, and then later in the day to go to the gym, right? So having that discipline of time blocking, so you're really focused. I relate it's like back in college, and you have to study for 3 finals. You're studying for chemistry for 3 hours. You'll take a little bit of a break, and then you're going to study for calc, right? You're not going to go back and forth. But I've been fortunate enough to build a really great team. We entered a deal with Sumitomo Corporation of America last year. So we, brought in a partner that has been really tremendous in helping us level up our talent and see our vision, which is important, and stay on that path to execute a vision. So people, I'd say, has been the most
Awesome.
That's great.
Yeah, I mean, we're experiencing that here at Nico Health. I feel like we hire someone every day, and they're just bringing so many like new, fresh ideas. You're not just in a bubble of the same few people they've been working with, which is great, but getting outside perspectives and actually being able to delegate work so you can scale while getting better at the same time. So I totally resonate with that.
Yeah, having like other brains at the table,
Yeah.
Totally.
you know, has been a game changer, and it just doesn't feel like sometimes from an owner's perspective that, or or CEO, it all falls on your shoulders to figure things out, and kind of spreading that around to realize, hey man, I could really rely on these people around me to want to
Yeah, it's
grow.
like that whole hippo concept has kind of gone to the side. It's like highest paid person in the room. Everyone looks for their approval or for their ideas. But now with like being able to even use AI yourself and like bringing on good talent, there's other ideas in the room that makes it really approachable, and you get some really cool things going when you wouldn't ordinarily before. But also, fun fact: Did you know that Wayne was also a trader early in his career too? Wayne was
I wasn't a
stockbroker.
trader. Yeah, I tried to be. Yeah, I would say I tried to be one. I was like an old school stockbroker is how I got into sales. So 10 days after I graduated college, my buddy was like, do you want to move to New York City? I'd never been to New York. And I worked at a firm called John Thomas Financials on 14 Wall Street.
Okay.
And I sit down and I'm wearing like a suit from like TJ Maxx or something. And there's no chair. They're like, all right, this is what you're going to do all day. They gave me a stack of Dun & Bradstreet leads, 600 index cards with guys like you's name and address on it. I had to cold call them with a bunch of notes on the back from hundreds of people that I called them since like 1990. And the first 60 days, no chair. I'm in a full suit, 600 calls a day standing. So that was, I think we were pitching like Caterpillar stock or something, but that's how I got into sales. And then luckily along the way, I got a job at a health tech company. So I got out of that, but
Yeah, did you
it was short lived, but it was,
What was your closing ratio?
it's not like it's not like it is now.
right? But it taught you resilience, right? Hearing
It
those
taught
no's,
me a lot.
what it is,
Yeah.
man.
It was
right?
600 calls a day, no chair. I was happy to be there. I was like, this is great. Like 14 Wall Street.
When
But
did
I'm
they
glad I
find
got
out
into
to sit
healthcare.
down?
I don't think I made it long enough to sit down.
No.
But
Never got a chair.
yeah, I mean, yeah, I never made any money, but it was an awesome experience. I was trying to get my Series 7, and then I stumbled into healthcare technology for the past probably 13 years now. So,
Oh, that's a
but
good
it got me into sales. It taught me a lot. I've always loved
Resilience.
finance and studied finance in school. Yeah.
resilience, man. That's what I tell my persistence, resilience, and resourcefulness are the three.
Yeah, I took the same skills over to Nico Health and then just kept. I never gave up on this though. I just kept at it, and it started to grow. And like you said, it's a big but small industry, so
Yeah,
you just
now
gotta
you're-
put
now
the
you're
time in.
The host of a leading podcast. On
Yeah,
iTunes and
now I'm
Spotify.
that was the
wanted
next
to,
year on the come up.
Speaking of which, Adam, now it's our time to do a little rapid fire with you, and then we'll close out the segment. So we'll just rapid fire questions at you.
These
You
are
just say
these are
yes.
easy. These are
ones
these
yeah,
are
they're
fun.
Hold on, let me take a sip of water.
All right, here we go.
Yeah,
First out-
can I phone a friend? Can I phone a friend if I need help?
Yeah,
Absolutely.
sure. You can.
Where's
Yeah,
Adam at?
Get
All right.
hand finger in here if you need him.
Oh, when I was gonna
no, it's
one thing I
easy
want to
stuff.
say that with the document crunch stuff, I followed on LinkedIn. I love the term the crunchers for all the staff there is awesome.
Right? Very cool.
Yeah.
Love Thank
it.
you. Josh Levy is a great leader over there.
Yeah, it's awesome.
Really good.
Okay, rapid fire. First app you open in the morning.
Oh shit! First after what is CNBC.
Okay. Go-to workout song.
Old school. There's no easy way out. Rocky IV soundtrack. If I really want to get one.
One thing your team teases you about.
My shorts being too tight, or my thighs
That's
being too
great.
big, as I like to say earlier today.
Yeah, I think when
That's
I met you guys at the Nico Health Med Trade after party, I was like, I think me and Handfinger were bonding over having too tight of pants, and then we're like, where do we shop? We're like, oh, we all shop the same place. Cool. Would you,
Pants store.
would you live in a treehouse or a houseboat forever?
Treehouse.
You can ban one corporate buzzword forever. What would it be?
Circle back.
That's a good
That's
one. Wayne, you know mine, right? My phrase. Do you know mine?
Living the dream.
Living the dream. I can't do that one. Another day in paradise.
Another day in paradise.
Yeah.
All right, Adam. I think we're all finished up with this segment. This was fun. I really appreciate your time in doing this. If anyone wants to reach out to you or if they have any questions, where can they find Adam Nagler?
You can find me on LinkedIn, or you can feel free to email me at adam@Quest Health Solutions. Happy to talk about anything in the DME space. I believe that I've said it before. I believe that there's more collaboration and less competition in this industry, in this market, because there's enough to go around for everybody, and I truly do believe that. And you guys are awesome. I appreciate being invited on this
Awesome.
podcast.
Absolutely.
Thanks, man. Well,
First
hopefully,
podcast, but not the last, Adam.
Yeah,
No,
hopefully
for
we
sure.
get you back. Maybe
We
we
did
get
that.
You got it
finger
out
on.
of your system. Rip the Band-Aid. Yeah, we're gonna get a hand finger on. Maybe an episode about the Crunchers.
There
Who
we
knows?
go.
Yep.
Yeah.
Let's do it.
Just let us know.
Perfect. Well, thanks, man. For our listeners, if you have not subscribed to the Claim to Fame podcast, do it now on all the major streaming platforms. Adam, thanks again. Talk to you soon, man.
Thank you, guys.
All right.
Take care.